Thank you. I can tell there's a lot of great discussion going on. And we know that sharing our own personal stories are sometimes hard, and we have to be vulnerable. But would anyone like to share what you guys discussed about in your partner sessions or in your table? Yeah.
I was talking about my experience. I'm a pediatric emergency medicine fellow. I'm from a pediatric background, and the first year of fellowship was pretty tough because we don't know a lot of emergency medicine things, like resuscitations, codes, that wasn't a thing that we did very often. And being someone's supervisor, not knowing how to call a consultant or how to put in a bed request was just kind of demoralizing. And I just remember, like, maybe after the first couple of months, I was like, I think they made a mistake. I think they messed up and read my CV incorrectly. And it took a while for me to realize that I know a whole bunch more peds than a lot of the emergency medicine residents, and that's why I'm here. I'm here to teach them peds, and they're there to help me get the emergency medicine side. So it took a while, but for a little bit, I was like, oh, I'm just waiting for someone to send me an email and say, deuces, but I'm graduating, so I think I did okay.
Thank you very much for sharing. And, oh yeah, who else wanted to share? Yeah.
Both myself and my partner, it generally came down to the breaking into a new group, because so I didn't train where I work now, and that's a huge group or hard group to break into. And Lane was saying he doesn't have a MD, he has a PhD, but he's still good enough and he still does awesome work. So when you're different than the group that you're working in, it makes it easier to feel that you don't really belong.
Yeah. Thank you guys for sharing. Anyone else want to share what they talked about in their? Yes.
One time, I'm a grandmother in emergency medicine. Not residency, yes, I'm residency trained, just in another field. And I worked my first 10 years small rural emergency rooms in the Central Valley of California, and one time I was working in this really big place, big enough to have 2 doctors on at the same time, and only 12-hour shifts instead of 24 or 48 hours. And there was this other guy that was working with me was residency trained, which of course made me feel pretty small to start with, and I figured I ought to be trying to pick his brains, but it was an era when you really didn't ask for help, or you didn't dare ask your attendings for help when you were a resident, unless you wanted a new one. And I ventured to ask him a question, and his response, the way he treated me, made me feel very, even smaller. I didn't dare ask another question that whole shift. I really did feel like an imposter as an emergency physician, even though I was boarded by that time.
Thank you for sharing. Any other brave souls want to share? Yeah.
I think for me now, working at Stanford, often people come in, and you guys know this, come in with various diseases, with like metals and whatever else attached to their bodies. And when I first started, so I trained in a county hospital. I worked in a county hospital before this. And then when I transitioned to Stanford, I remember this first time when I said to the patient, I have no idea. Like, I don't know. And at that moment, I felt like maybe I don't really belong to work at Stanford. To now, I actually own that. It's like one of my favorite things to say, because it acknowledges to the patient that I don't have to know everything, but I'm willing to work with them to figure out what's happening. But it took me a while to get past that imposter syndrome, to say like, no idea. I had to look this up, because this is a syndrome that I've never heard of before, because this is what we see.
Thank you.
So I'm an early career physician. We have a statewide QI collaborative in the state of Michigan where both PEDS and ED personnel are a part of it. So I represent my hospital, and I'm a part of the executive committee. However, when we have our executive committee meetings, and you share the table with much more senior faculty and accomplished people with fancy titles, and I do not have any fancy titles whatsoever, you get that feeling sometimes, am I good enough? Am I competent enough to be here at this table with this esteemed faculty who have established themselves who are who's who in this field. So yeah, you do get that feeling sometimes.
Thank you for sharing. Yes.
Mike brought up a really interesting concept that, and I'm kind of hearing this being echoed around the room. A lot of us put in this effort and love and almost self-worth being reflected into the institution that we're working for. You discussed, like, am I good enough for Stanford? And I had said the same about my school. You know, did they just pick me on a whim? Was I good enough for them? And he was saying that the institution can't love you back because it's an institution, and you're projecting your own feelings off of something that can't give you that sense of love and fulfillment back that you expect. And that can kind of set you up, I think, for heartbreak. So that's something that moving forward, if we can keep in the back of our minds that I can't get the fulfillment from this, it's falsely placed, it's within myself.
Thank you. Really well said. Anybody else want to share? Okay, we'll have other sharing opportunities. So, bringing it back, like we talked about, there's been a lot of data and research studies to look at imposter syndrome in different communities, different demographics. But really, when we think about imposter syndrome in medicine, since we're all in medicine, there's really little data to support kind of what imposter syndrome looks like within medicine. There are some studies that I'm going to talk about that have explored imposter syndrome. So this specific study looked at the effect that imposter syndrome has on medical students, so particularly early on in our trainings. In our training. So this study was 130 medical students in Jefferson Medical College, and it was an online voluntary questionnaire that the medical students filled out, and really kind of like similar to the one that you filled out today. They filled out a survey online that looked at different features of imposter syndrome. And here, this right here is what was statistically significant associated with imposter syndrome. So when we look at it, the female gender, so women are 2 times more likely than male medical students to experience imposter syndrome. Here we can see 50% females said that they have experienced imposter syndrome once in their medical school career, as compared to 23% of male medical students. As well as here, when looking at different components of burnout, so whether you were physically exhausted, you had feelings of cynicism or feeling jaded, when you had emotional exhaustion or depersonalization, not feeling like yourself anymore, those are not characteristics or qualities that we want to be instilling in our early trainees. And yet, here we see that medical students who are more likely to be experiencing these components of burnout if you're also feeling imposter syndrome. Lastly, this is a very interesting one. The 4th year of medical school was statistically significant associated with imposter syndrome. And here, what I see a lot of our medical students shaking their head, and I would agree, same thing as me. You know, you saw my match picture. I was feeling imposter syndrome on match day. But here you see this is 4th year of medical school is a very important time in our trainees because we're deciding where we want to go and what type of physician we want to be. If we're feeling imposter syndrome when we're making those decisions, we could potentially be limiting our possibilities in our future career. And this also is important because imposter syndrome has been characterized to be specific and more pronounced in periods of change, so in transition. And here we can see that 4th year of medical school is a huge transition period from going from a trainee to now actually going to residency. Our next study that I'm going to be talking about is looking at imposter syndrome in residents. So this study looked at 185 family medical residents in Wisconsin. Here, 1/3 of those residents indicated that any time along their residency they have experienced imposter syndrome. Once again, this was also an online survey. Here, once again, the female, so being female, 41% of females residents are more than double, or almost double, as compared to male, are more likely to experience imposter syndrome. Here, feelings of having depression and anxiety was also significantly associated with imposter syndrome. And this quote right here is also very interesting. A lot of the residents indicated that they believe they will not be ready to practice after residency. And this is interesting because these same residents who believed that they will not be ready to train to practice after residency also indicated that they felt they were qualified and that the training they were getting was meeting all their qualifications. So here is kind of one of the themes that we've talked about today. You feel like you're not ready, but when you step back and look at the training that you're having, you actually are qualified enough to go on and pursue that next position. So this was something that those residents echoed as well. Lastly, the last quote I want to share with is a study that looked at imposter syndrome in attendings. So when we look at attendings, we think about you're done with medical training, you're kind of at the top of the top. I can't wait to be an attending. But here we see that attendings are also feeling imposter syndrome. This quote, let's go back. Okay. This quote says, "Many of my colleagues and I often talk about the imposter syndrome, and we feel like someone's really going to find out that I have absolutely no idea what I am doing. I still think someone is going to send me a letter saying, actually, it was a mistake. You weren't supposed to get into medical school. Therefore, we're taking it all away. And yet, you go on and pass all of your exams with flying colors. But is this who am I, and am I really capable of doing this?" So once again, this is kind of one of the themes that we've some of our people here at the conference have shared, that we still feel, even though at this level of our training, we still feel that we haven't deserved the position where we are today. There we go. Okay, so now we wanted to do another small group session. So if you go to page 3, we actually have a case that we want everyone to work on in your small group tables. So this is a case that we made that we feel, if you guys can go ahead and read the case and think about these 3 questions and talk about them as a discussion in your small group. So the first question is, has something like this ever happened to you, and how did it make you feel? The second question, what are some of the factors that contribute to this happening? And lastly, and I think the most important part of what we want you guys to take home with, is what can individuals, peers, and institutions do to help? Okay, so we'll give you guys about 10 minutes to work on the cases in your small groups, and we'll come back and share as a large group discussion what you guys came up with.